Tracking healthcare for you, early numbers are showing enrollment is down for the Affordable Care Act. And experts say rising costs after expiring subsidies played a big part here.
So this means some Americans are now living without health, vision, and dental plans. So I traveled to our southern border to see how this could impact medical tourism in one of Mexico's busiest spots for care, and also what to know if you do decide to take the trip. Every day, people from Arizona and all over the country head south for medical care. For many families priced out of U.S. health care, it's become the only way to see a dentist or get medical treatment.
Saving anywhere from 50 to 75%.
It's a big difference.
You bet.
Danny is one of those Americans forced to get dental care in Mexico due to cost.
When you don't have insurance coverage, you got to go where you got to go.
We caught up with him coming back from Los Algodones, Mexico, near the Yuma-Arizona border. He's just one of the thousands who do cross the border every day to get care. One of the reasons this area is so popular is the accessibility, because as soon as you cross over into Mexico, the clinics are located just feet away. It's the location, the savings, and services like stem cell therapies.
We have different regulations from the United States.
Jesus Garza works with GeoStar Mexico, a medical institution with locations in Los Algodones, Cancun, and Playa del Carmen that specializes in different treatments for diseases and autoimmune conditions. He says patients are flocking there because there are more treatments to choose from.
They have a broader, wider range of options to treat their conditions.
Jesus also says they've noticed more patients over the last few years, and they may see more in 2026 because at the end of 2025, enhanced premium tax credits expired, triggering higher costs for coverage. And Dean Frederick Wondesford from the University of Arizona's College of Medicine says medical tourism could go up because of this.
But I think now you might see people crossing the border to get primary care if they can't get primary care in the U.S.
Michelle and Mike do have medical insurance, but it adds up to about $1,000 a month for the two of them.
So yeah, hers and mine, it's quite a bit a month, when you're retired. I mean, for people that didn't save for retirement.
Dental, so we have to pay dental out of pocket.
For a single dental implant in the United States, the average cost is between $3,000 and $5,000. Compared to Mexico, it would be around $1,000. And prescription costs, they're significantly lower too. A vial of insulin in the U.S. could be more than $100, while in Mexico, costs are between $20 and $40.
If there is an option to get your medicines cheaper, I don't think we should penalize people in the U.S. for trying to do that.
Now, they should be the same drug as in the U.S. if bought from a reputable pharmacy in Mexico. But as with any big decision, experts say, do your homework, check the credentials, talk with your providers, and know what you can and cannot bring back. Reporting in Southern Arizona, Allison Rodriguez, 12 News. So customs officers say, here's the thing, you can bring back many prescription drugs, but they have to be in small amounts and they're for your personal use. You keep the meds in the original pharmacy container and make sure you have your U.S. prescription note from your U.S. doctor. You can't just go there and get something that you normally would be prescribed here. I mean, well, you can, but you wouldn't be able to bring it back into the U.S. And then also be ready to show your ID. Now, as far as what you cannot bring back into the U.S., you can't bring back drugs that have not been approved by the FDA. Also, certain painkillers and controlled substances, those are restricted. And officials, by the way, they can seize anything that does not meet U.S. rules. So maybe you're thinking you've heard all of that and you do want to cross over into Los Algodones for some care. Well, there is a parking lot right there for you to park and then walk in. And it can be pretty quick too, though. Sometimes people have reported waiting in line for about an hour, 2 hours. You need a valid passport or the passport card to cross. And officially, a tourist permit is needed called a multiple immigration form. But here's the thing. It's not always requested by Mexican authorities. But if you want to avoid any hiccups, you can go ahead and fill one out. Just head over to gob.mx.